I'm here with Regina Holliday, who is the organizer, soul, heart, and spirit of the Partnership with Patients Summit. Hi, Regina.
Hi, it's so good to see you.
Thank you. Tell us about what the Partnership with Patients Summit is.
Well, it was a decision that a whole bunch of patients made that we were going to have our own summit. Basically, we were told by the Partnership for Patients campaign that there was no federal funding for us to get together and actually advocate and talk with each other. And we thought, that's wrong. Well, why don't we have our own summit? We'll figure out the funding, we'll crowdfund it, we'll find a vendor willing to give us space, we'll do everything we can.
And what were you hoping to achieve with the Partnership?
Well, first thing, there's multiple goals within this summit. One is the goals of the Partnership for Patients campaign, which is a reduction in healthcare harm. We want to try to figure out how can we as patients advocate to reduce healthcare harm, and especially 20% reduction in readmissions.
What do you mean by healthcare harm?
Well, specifically, 20% reduction in readmissions by 2013 based on 2010 data sets, and then 40% reduction in hospital-acquired conditions, hospital-acquired infections, again by the end of 2013 based on 2010 data.
Okay, now you have such an array of eclectic speakers, from providers to digital companies to patients like myself. How are you able to sell it to such a well-rounded amount of people?
Well, I think we need all of these skill sets trying to address harm within healthcare. If we're going to have better systems, we need everybody. Okay,
now you also have this walking gallery. You paint beautiful like murals on the back of jackets of people. Can you explain how that started and why it started?
Sure. Well, there's this great lady named Jen McCabe who asked me to paint the first 3 jackets that were just art jackets, because she said it was really frustrating. She'd go to conferences, they wouldn't invite a single patient. So she wanted to project what I talk about within patients' rights at conferences. So I painted a couple for her, and then a couple other people.
So give me an example, like what would be on the back of someone?
Oh, like hers said data prisoner, and it had a patient in handcuffs.
Okay.
Because we are not allowed to get our data in a timely fashion.
Okay.
So, and then Shira Bell wanted one about caregiving, so I depicted a patient in the last throes of cancer.
How long ago was that?
This was in the fall of 2009. Then, almost a year later, in 2011, April of 2011, we came up with this brilliant idea that we go beyond just a couple of jackets to an entire gallery that would walk around the world representing the patient voice in the medical conference.
So how many jackets
have we done since 2011?
Yeah.
We're now at 195.
Wow. So how does someone qualify for you to say, hey, I want to paint a jacket?
Well, they just ask.
That's pretty cool.
Yeah, they basically ask to join. There is no charge to join the gallery. We do accept donations. We do not require them. So anybody can join.
Another thing I've noticed during this conference is that it's another intent of yours to help people like myself who are chronic patients to speak at lectures and maybe earn some money. So you've gone out of your way to have speakers share tips on how to do it. One of them I was very impressed with. I looked at your, I think it's called SpeakerLink. What is the exact URL of your SpeakerLink?
It's speakerlink.org.
So speakerlink.org, and then you have a specific profile on that link.
Yes, I do.
And I noticed that it lists your speeches, your keynotes, maybe some videos of what you've done, some stills, and you found that to be a great landing page to get gigs?
Yes, it has helped a great deal. I'll get at least one seeker, they're called, the people looking for you are called seekers, a month from SpeakerLink, where they'll ask me, can you do this event? And if I can't do it because I'm already booked, I then send them 4 or 5 other profiles of other speakers on SpeakerLink that I would recommend.
That's really fantastic. And I know you're Russ because you're, like I said, you're the heart, soul, spirit, and organizer of this event. Who are some of the sponsors who helped you out with this event?
We've had so many wonderful sponsors. So the location we're having this is Cerner, and they've given us the space, and they've helped us with coordination. It's been spectacular. That InTouch Solutions paid for patient travel, they paid for food, and they paid for more PR in this area. We had Pocket Health. They were responsible for helping pay for the food that's at this venue. We also had MedStarter and Health Tech Hatch, 2 new crowdfunding companies that work with us to crowdfund this event so we would have more patient travel, as well as, covering all the costs. We also work with the Society of Participatory Medicine. They created a fund to help have patient travel, and they're a nonprofit, so people could donate to it for the tax write-off. We also had M3, which is a company that Steve Davis had, and he helped. CMR Open helped. Illy helped. It's just a really long list.
I want to end on this because I'd be remiss if I didn't. You also offered 10 travel scholarships, of which I was fortunate enough to be selected. I wanted to thank you for that. I think I was honored, and it's been an incredible experience, and you are to be commended for doing all this, because you don't look as stressed as I know you must be. And so thank you very much.
Well, thank you so much. I'm so glad.